On Wellness today, we are focusing on nursing. We have Rahima Jima, a registered nurse passionate about public health, the perception of the nursing profession, and the human side of healthcare. Now, the question is, who really is a nurse? Are they just doctors' assistants, or are they so much more? It's great to have you here in the studio with us.
Yeah.
All right, so Rahima, what were you doing this morning? We had a conversation this morning, and you weren't able to make it earlier on the show. What were you up to?
So I was at work. I did a night shift.
Okay.
And the patient suddenly deteriorated, had hypoglycemia, hyperthermia, and we had to resuscitate the patient. And so I was running late. Yes, that kept me.
So you did resuscitate the patient.
Yes.
The patient is fine.
Yes.
Right?
Yes.
Now, one would have thought resuscitating a patient had more to do with the doctor, right? Based on what we think about when we think of healthcare, we think mostly of doctors. We don't think of nurses. Why do you think that is?
I think there's a lot of misconception about nursing, and it's one of the main reasons is the mainstream media in Nigeria and Hollywood, which has bad portrayal of nurses. And it's so disheartening that the people who are the front line of healthcare, they are usually reduced to background characters. So in resuscitating a patient, healthcare is a teamwork. If one person could do it, we'd have only one healthcare professional, but we have different healthcare professionals. And then this teamwork, working together, doesn't mean subordination. So collaboration is not equal to subordination. Collaboration is working together to achieve a common goal. And then the nurses are the ones with the patients all round the clock. They give continuous care. The nurses are usually the first people to notice when there's a subtle change in a patient, either vital signs or just a patient's countenance or patient's consciousness.
It's usually the nurse that notices,
yes,
not the doctor.
Most times it's the nurses because they are the ones with the patient 24/7. They give continuous care. So most times the doctors are focused on the diagnosis, the treatment plan, but nurses are focused on the human side of healthcare. They see the patients beyond their diagnosis. They see the patients as individuals who have families, who have fears, who are anxious. So they treat them as humans first, beyond their diagnosis. They give patient-centered, holistic care.
So I have to say, there has been that mindset, and you mentioned mainstream media, you mentioned Nollywood just now, that nurses are just the doctor's assistant.
Yes.
So how does that make you feel whenever you hear that? And what's your response to it?
It makes me feel, it's very disheartening, right? That the people who are at the front line of healthcare are reduced to background characters. It makes me feel sad that people do not see what nurses do. And then what this media representation does in the long run is that people already have this misconception in their head that, oh, I'm going to the hospital, when I see a nurse, this is a doctor's assistant. They do not give nurses the respect that they regard, and then it reduces the esteem of the profession. It reduces the dignity of the profession because people do not see nurses as people who carry out responsibilities on their own.
So if nurses disappeared from the healthcare system, of which over the past 2 years, we were hearing a lot of nurses were relocating out of the country. They were going to the UK, going to Canada. If they completely, disappeared, what exactly would happen to our healthcare system?
If they disappear for...
What? Okay, let's say a week. A week. Is that too long? Okay, a day.
If they disappear for 3 days, healthcare will suffer. And if they disappear for a week, the entire healthcare will collapse because nurses are the ones who give continuous care. And that's what healthcare needs, continuous care. I think sometime last year, around August, nurses went on strike for like 4 or 5 days. The doctors they felt it because there was nobody giving that continuous care, nobody with the patient 24/7. They had to discharge a number of patients, they had to change their medications to orals because they couldn't give the continuous care that nurses give. And that's the unique function of a nurse.
So nurses are not wicked?
Nurses are not wicked.
Are you sure?
Personally. Have you met me?
All right, but you have to be, but you have to think about the fact that nurses also have to be strong-handed.
Yes.
Right? They have to have a strong hand to be able to deal with different types of people, different ages, different backgrounds.
Yes.
Talk to us about that.
Okay, so you just need to be firm. You don't need to be wicked. So personally, I've never met a wicked nurse.
Really?
As a patient and as a nurse, honestly, I've never met a wicked nurse. The thing is, a lot of patients come with the misconception that nurses are wicked. So they already relate with you with that kind of energy, right?
Okay.
And then sometimes patients don't want to listen to the nurses because they believe that the nurses probably don't know what they're saying, which is wrong. So all these things in turn affects the kind of care that the patients will receive, not because the nurses want to be wicked towards you, but because there's no understanding that as a nurse, I'm a professional on my own and I can carry out my own independent actions.
So now, I'm thinking about what you just said now, that there's an assumption that people believe nurses don't know what they're saying. Why do you think that is? Nurses also go through a lot of training.
A lot of training.
Talk to us about the training you went through and why that misconception is so.
Okay, so in Nigeria currently, you have two routes to become a nurse. Either you go to the university and earn a bachelor's degree in nursing, you earn the certificate of a registered nurse and other certifications, or you go to College of Nursing and earn higher diploma in nursing and RN certification, right? Yeah. So I went to the university and I studied nursing for 5 years.
Wow.
We had coursework, we had clinicals, we had to research.
Wow.
To graduate as a Bachelor of Nursing Science, with Bachelor of Nursing Science, you have to write at least 2 research.
Wow.
Every other person, people in other fields, they probably write only 1 research work, but nurses, because research is one of the important things that nurses also do. So nurses work beyond the bedside. They're into research, policy, and a whole lot more. So all those things affects how.
Now, presently, you work in a hospital that has a lot of turnover of patients, and it's because it's a general one. It's a general hospital, right? And a lot of people sort of they avoid general hospitals if they can, right? And from the nurse's perspective, right? Why do you think? What do you think we could do to improve that mindset?
The mindset that nurses are wicked?
No, well, the impact of going to a general facility. From a nurse's perspective, what do you experience there?
Okay, I would say that firstly, a lot of patients. So in healthcare system, there is primary healthcare, secondary healthcare, and tertiary healthcare. All these are in place to ensure that there is no overload in a particular facility. Okay. So when you have basic things like malaria, maternal and child-related diseases, you could go to a primary health center. Okay. Which is the one, there's primary health center in probably everybody's neighborhood. So before you come to the secondary health center, you probably have a referral from a primary health center. Sure. But a lot of people would come with basic illnesses to the secondary health center, which would in turn have increased the load of patients. On an average, in general health patients, you have like 150 patients coming in. In a day? Or? Yeah, in a day. In a day, 150 patients? More than. Wow. We are short-staffed at nurses. You probably have only 5 nurses coordinating 150 patients, checking their vital signs, triaging, ensuring that you give priority to the ones who have more severe illnesses. I think one thing that we can do to reduce this is encouraging people to visit primary health centers. And also, when the disease is not too much, they could go to primary health centers instead of coming. All right. Now, where do you see this going? This conversation you're having, there's a reason why you're talking about it. Improving on, you know, the way people see nurses. I know of some families that if their children told them, oh, they wanted to be a nurse, they'd be like, why not a doctor? What can we do to sort of change that mindset? So I think one of the most important things we can do is what we're doing right now, to educate people. And then education is not enough. I think interactions. So every nurse has the responsibility of sort of convincing any patients that they interact with through empathy, total patient care, just being a good nurse as you should, right? I think interaction changes the narrative one step at a time. So when you have a patient that meets me, for instance, and you say, oh, I met that very nice nurse, right? Your perception starts to change. That's first. And also the media representation. That's why organizations like the NCI comes in. It's an NGO that promotes the image of nursing in Nigeria. So they release movies every year. I think they released their 3rd movie this year. They release movies every year to educate people about nursing. Yes. Powerful. Powerful. And yes, I do remember. So I watch shows like
you know, Grey's Anatomy, you know, Dr. House, you know, The Good Doctor. I watch shows like that abroad, which really highlight the medical profession abroad. There have not been that many here. There was a major one here, but then again, the nurses there were a little bit wicked.
Exactly.
When I think about it, the reason why I'm saying this is because there was one where there was a nurse called Nurse Titi, and I keep hearing that Nurse Titi thing. Anytime I wear anything like scrubs, I hear Nurse Titi, and it was because apparently she was, you know, a little bit mean, which is why people remember her. But then I think, yes, indeed, we have to do a little bit more to sort of change the mindset and the perception, and hopefully we're on the right path. But I have to say thank you to you for coming to talk to us about this.
Thank you for having me.
You've told us who a nurse is and what they represent, and hopefully it'll help to change the perception for someone out there. So, in your family, would you like to encourage a family member to become a nurse, to be building a career in nursing? Is this something you've thought about doing? Is this something you want to probably approach yourself? Please let us know. Use our hashtag WakeUpNigeria on TVC. We're looking out for your comments. Okay, then we're taking a quick break at this point. We have so much more coming your way on Wake Up Nigeria.